We had a patient who was very delusional, trying to get out, tried to leave the unit. And in my efforts to stop her, she slapped me, knocked my glasses off, that sort of thing. Yeah.
There's some instances where you feel like you're just doing your job and it's part of your job, but it's really not.
When I was a new nurse, I would just take it for granted, saying that it's okay, this is how hospitals work, different people work here.
So I really don't think nobody should be in a position to feel like, maybe I need to leave this job.
So one of the big things that we rely on is training and communication, not only with Baptist East, South, and Prattville, but other local hospitals. And in the Southeast region, we reach out to their training coordinators to, hey, what are things that you're seeing in your hospital? What are things that you're doing that we can implement to prevent violence from happening in the workplace? The big thing we see it time and time again, we'll hear from nurses days later after an event that, oh, this is normal with this one specific patient. We're used to them yelling or we're used to them slapping. And that just shouldn't be the case. No time should you go to work and be like, oh, it's okay to be slapped or it's okay to be yelled and cussed at. What we want to do and what we strive to do is prevent that from ever happening. We know we can't always prevent it, but what we never want to happen is actual physical violence. So as soon as they feel uncomfortable, as soon as they feel like a situation is going south, just report it. That's the only way that we can prevent it from happening in the future.
I think as a leader that we have to just be present and under the staff understanding that if you don't report, then maybe it's not known. And as a leader, just making sure that you're doing the right steps to promote the staff to feel comfortable to report that acts of violence, or that making sure we need to evaluate that we're doing the best that we can. I think that our staff has increased with reporting, but I do always think that there's areas for opportunity to better improve our reporting process.
Being a victim of workplace violence is nothing normal. Being assaulted, whether it's physically or verbally by a patient or a patient's family member or another staff member, it's not normal for the workplace. So it's really important that we report those up the chain of command.
We got resources here and they help us. And like, when we know that stuff, it's easier to talk about it and report it. It's not the best thing to do, like go home after getting probably hit or something, then come back like a few days later, hey, I was hit. It's better if we just report it right away.
If patients become combative or abusive, whether it be verbally or physically, the best approach that I've found is just to be reassuring to them, remind them where they're at and what your role is in their care. Hey, listen, I know you may be confused or I know you're not feeling well, but we're all here because we've been called to serve. We love you, we care for you, you're in a safe space. I think as healthcare workers, we have to be the biggest advocate for the patient, and yes, we are there to do a job and to care for them, but also to remind them that they are here voluntarily.
Reporting is very important, and I do encourage it, and we have to, as charge nurses, as leadership, we have to not only encourage it, but require it. I know a lot of the nurses who don't report it or don't want to report it, it's because it's extra work. To be honest, it's extra time that they don't feel like they always have. One of the things I try to do is, let me help you with that. Let me take your patients, or let me handle your patients while you fill out the form, or let me help you fill out the form to lessen their burden of time. I try to encourage the nurses that if you want management to help protect you, they have to know what they're protecting you from. And they're not on the unit every day, so we have to make sure they know what you're facing.
Me coming from a different culture background, anything is like, okay, never mind, it'll be all right. Everything will be all right. But sometimes it doesn't work that way. I mean, it's very important to report so that if we don't report, how will the management be aware of, and how will they resolve the issue? And once, it's just taking the first step, that if the nurse would take a first step, she can probably pass on to the co-workers and tell them that, hey, I think so, you should report this incident, it's very important. So it's like a chain, so once you start it, it goes around the whole circle, and the circle is complete.
It's brave to step up and say, it happened to me. There might be even a little bit of embarrassment linked to it. And that shouldn't be the case. We should be able to freely, talk about what has happened and how we can better support our team members.
I will report.
I will report.
I will report.
We will protect.
We will protect.
We will protect.
And we will protect.
We will protect.